Ambassador opening remarks, His Excellency Mr. Hector Virgilio Alcantari. Please, my apologies, Ambassador.
Good afternoon. No. Okay. Reflecting on the theme of this event, the first things that came to mind were these two questions. How is it possible that societies went from having the greatest respect for the older person to discriminating against them in almost every way imaginable? From treating them with the greatest dignity and reverence as custodian of the common history and cultural heritage, to considering them as a burden that we must get rid of as soon as possible. That is, however, the painful reality of our present, a painful reality that we have the inescapable duty to face with the greatest urgency. With the greatest urgency, because the growing aging of the population is a trend that characterizes our time. And social harmony requires attention to the consequences that derive from it. The first thing is to ensure that we have national and international legal framework that effectively guarantee the full enjoyment of all human rights to the population group represented by the older person. And as soon as possible, to face all the type of abuses they had been subject to, and which have become, according to the World Health Organization, an important and serious public health problem. The main abuse is discrimination. Discrimination that manifests itself in a wide variety of ways, such as lack of access to training programs in new productive skills, isolation, neglect, physical exploitation, financial exploitation, and worst of all, physical and psychological violence, and the lack of attention to their basic needs. What alarms about the abuses against the older person in our societies is generalization in all areas, because these abuses occur in homes, in health centers, in the labor market, in the media, in communities in general, and even in the areas where they are admitted to receive emergency and humanitarian care. Having identified the wide range of abuses to which older people are subjected, especially those with disabilities, what corresponds is to face the factor that put them at risk. Given the limited effectiveness of most of the measures that have been tried so far in preventing and responding to such abuses, we look forward to the acceptance of the finding and contribution of the independent expert, Ms. Mahler. Her report shows her professionalism and her committed dedication to the study and analysis of the barrier that hinder the enjoyment of all the human rights of the older person. She did not limit her report there, but took the next step to suggest many wise preventive measures and compromises for states, organizations, and communities to ensure the protection of older persons against abuse. I only hope her recommendations are accepted as a promise of change in the life of this population group, a change that leads to guaranteeing throughout the world their independence, their inclusion, their care, their self-realization, their dignity, and above all, a life free of violence. I thank you.
Muchas gracias, señor embajador.
No se preocupe. Muchas gracias.
Thank you so much, Your Excellency, and really we thank as well all the support of the Dominican Republic, and we are happy to see them and the group of friends, and we look forward to working with you a lot. And now I give back to Claudia.
Thank you. And I think what we also see is that we need a lot of promotion of the human rights of all the persons, and we need also some goodwill ambassadors, and I'm looking forward to also increase all the meaningful contributions of all the ambassadors here in the room and all the missions here in the room. I'm very grateful that you're all here, and let me start by saying it is estimated that in 2050, 1 out of 6 people will be 65 years and older, and this is putting more people on risk to be an older person and risk of violence, abuse, and neglect. The World Health Organization estimates that 1 out of 6 older persons have already experienced some violence. Violence against older persons really remained overlooked. We also heard about this in today's interactive dialogue, that many missions also agreed that this is a totally overlooked global phenomenon. It is still a taboo, and there is also a lack of research. As I said before, ageism and age discrimination are the root causes of violence against older persons, because these negative stereotypes bring the notion that the life of older person is not as valuable as others. This is why we need to combat ageism as a first course. The international human rights law provides to some extent protection against violence, abuse and neglect for older persons through already existing legal instruments. As we know, the Universal Declaration of Human Rights emphasizes the right to life, liberty, and security of persons regardless of age. But it does not really focus on older persons, as well as all the others. There is also Article 3, which prohibits the torture and degrading treatment in the Convention Against Torture and Other Cruel, Inhumane, and Degrading Treatment. And these also specifically address in Article 1 what I just said. There is also the Convention on the Elimination of All Forms of Discrimination Against Women, which focuses on eliminating all forms of discrimination in Article 2, including violence against women. But there is no specific focus on old age. The Convention on the Rights of Persons with Disabilities provides explicit safeguards for older persons with disabilities from ill treatment, Article 16 and 17. And we also do have the UN Principles for Older Persons, which state in their principle that older persons should be able to live in dignity and security and be free of exploitation, physical or mental abuse. We also know that there are a lot of some recommendations, general recommendations, for example, 27 from CEDAW, which tackles directly all the issues in regard of older women, which is also already a very good starting point, but it's not good enough because it only tackles a little bit more than half of the population in old age.
It's not legally.
It is also noteworthy that the general recommendations also refers to this article, to this general comment 27, and the general recommendation is addressing gender-based violence against women of all ages. But this also does not include older women directly. Indeed, states have the obligation of the duties to respect, protect, and fulfill. And the duty to protect includes that states must protect older persons from violent measures from state and non-state actors. However, it is important to note that there is still a lack of specific provisions addressing violence, abuse, and neglect of older persons. And there is a unique risk faced by older persons in this vulnerable situation because it's not addressed in the current human rights framework. We also do have some regional aspects at the regional level. The Inter-American Convention on the Protection of the Human Rights of Older Persons calls for comprehensive measures to prevent discrimination and promote well-being, including the right to safety and a life free from violence and of any kind in Article 9. The Convention furthermore protects older persons from violence with an intersectional approach, and it identified situations of multiple discrimination. And I think this is really an added value because this multiple discrimination is not really tackled in all the other conventions. This would also be an added value in a convention on the rights of older persons in a universal one. The African Protocol to the African Charter on Human Rights and People's Rights on the rights of older persons and persons with disabilities recognizes older persons' rights to freedom from violence, abuse, and neglect in their Articles 8 and 9. I also checked what is there in the European human rights law framework. There is no specific dedicated convention on the rights of older persons, but we can find some hints either in the Council of Europe's convention as well in others. What is also key from my perspective, from a legal perspective, is that the comprehensive legislation is fundamental to effectively address, also on the national level, the scourge of abuse against older persons. Such laws are critical to establish norms of acceptable and unacceptable behaviors against older persons. And we also learned in today's ID that many states already do have some laws on the national level, but I also heard in conversations that the implementation is not totally effective yet. So I think we also need to have more ombudspersons or other monitoring mechanisms who take into account the better implementation of these laws as well. Access to justice is also a huge topic for older persons. On the one hand, very often it's hard to find the information where to go and how to get support. On the other hand, we also hear that very often the court procedures take too long for older persons to get their rights. I think this is still something where we need to look into if the barriers to access to justice are too long to tackle the issues of violence, abuse, and neglect. And I think we need to find more direct applicable measures for older persons and violence abuse. I stop here, and I'm looking forward to also have conversation with you to get into more depth or to discuss into more depth. Thank you so much.
Thank you so much. And this is exactly what we need to draw the picture, the real picture of how we are looked or overlooked in the international human rights framework. Thank you, Claudia. And now I pass to, may I call you Tony?
Yeah, sure.
Tony from the NHRI in Nigeria. I understand that you do a lot of work on violence against older persons. And please, give you the floor.
Thank you very much. The International independent expert on all rights of older persons, Madam Chairperson, Your Excellency, Ambassador of Dominican Republic, and my co-panelists. It's really indeed a pleasure to speak after the report of the independent expert that everybody has agreed that the scholarly work into that work is very, very excellent. For us at the National Human Rights Commission of Nigeria, she came to visit us last year, and we worked closely with her, and we're able to share with her the kind of experiences we have in the field. Of course, you know, national human rights institutions are there to promote and protect the human rights of all persons, including older persons. We are an A-status national human rights institution. That means we are compliant with the Paris principles. And in that regard, we do receive a lot of complaints on the violation of the rights of older persons. From our records, in 2020 alone, we recorded about 600 complaints. In 2021, we recorded about 1,880 complaints. However, in 2022, we recorded only 80 complaints. Now, all these complaints are not necessarily on violence against older persons. But the drop in 2022, we explained, is as a result of the establishment of a focused agency in Nigeria, the National Senior Citizen Center, which was established by government in 2021 to focus now on the protection of the rights of older persons. So we tend to be sharing the responsibility of complaints now on older persons. Having said that, so generally in a year we receive about 2 million complaints, and then the figures I gave you are the proportion which relate to older persons. Now, the kind of complaints we get are something like, for instance, there was a case of an 82-year-old man in Calabar who had prostate cancer, and one of his children, the son, took him to his house, and of course the medical bills to take care of the prostate cancer was getting too much, and the other children were not contributing. They started having issues, and they now had to bring the quarrel to the commission that the other ones were not contributing to the upkeep of the health of the father. And then we're able to develop a memorandum of understanding on what they should be contributing to take care of the health condition of their father. But there is the sad one of a 72-year-old man who was alleged to have been responsible for the death of the son, the daughter-in-law, and their 2-week-old baby. What simply happened was there was a thunder, there was rain, and there was a thunder. And the thunder, the lightning killed the son, the daughter-in-law, and the 2-week-old baby. And he was accused of witchcraft, that he uses such opportunities to do witchcraft and kill people. And they dug a shallow grave and buried the man alive. So, we as a commission, when we got to learn about this, we had to alert the police. We went, 4 people have been arrested, and we insist that they must be prosecuted for murder because, I mean, that kind of attack on an older person that is a witch is unfounded. Now, there are cases of non-payment of pension by governments, you know, older people who have worked all their life, contributed to the pension scheme. These monies are, you know, not paid to them as at when due. So we engage the National Pension Commission and the Pension Transition Directorate to make sure that their pension are processed and they are able, because at the root of most violence against older persons is the issue of poverty. You know, poverty is a major issue. If you don't have the financial resources and you are dependent on people, you are open to a lot of abuse, you're open to a lot of neglect, and that is what happens. So ability for them to have resources at that age is very key to their being free from violence and abuse. We also receive complaints on demolition of houses belonging to older persons, because most of them also live in shanties and slums, where when the government wants to say it's going to do a new development area, they easily go and demolish all these places. And also they take over their lands, their communal lands, without payment of compensation to them. And this is also in line with the report of the independent expert, when she said that the issue of destitution among older persons, especially older women living in rural areas, remain common, and many of them are victims of property grabbing. So that's quite in line with the report of the independent expert. We also received a lot of complaints on gender-based violence and spousal abuse within the family. I'm sure this goes on in many places. And like the independent expert had rightly said, gender-based violence and discriminatory societal attitudes towards older women are rampant in Nigeria. Older women living in polygamous marriages are at the risk of being subjected to violence and abuse. And now, what we have done is this independent expert has raised a lot of issues, a lot of recommendations, and we, even ahead of her report, stakeholders who received this very well are already trying to see what we can do in Nigeria to respond to the issues raised. For instance, in August this year, the Nigerian government, in collaboration with the World Health Organization, hosted a summit with stakeholders to x-ray the gaps and challenges which had been highlighted by the independent expert, especially in terms of the healthcare, and also to fulfill the healthy aging 2020 to 2023 policy. Even though the bill on older persons, which the independent expert had said that if this bill is passed, it was going to deal substantially with the issue of violence against persons, we are making sure that that bill is being represented to the parliament to make sure that violence against older persons are adequately protected. The Minister of Humanitarian Affairs also, in response to the recommendations of the independent expert, they are now trying to compile a new social investment register, which did not take into consideration older persons before as a vulnerable group that should be captured in that register. The register is now being revised, and the governors of the states and local government chairmen are asked to factor this in compiling that register. And then the issue of universal coverage in terms of health is also being addressed. There's a new health insurance policy, which the older persons are not required to pay for hospital bed or consultancy fees, and they will only pay 10% of drug costs. So let me stop here so far. Thank you very much.
Thank you so much. Thank you so much. And that, again, shows the importance of working together with the NHRIs, and in all countries include older persons, but really your role is crucial. And now I'm going to introduce Bridget Sleeve, a friend, and she works in Human Rights Watch, and we are very happy that Human Rights Watch also has a senior researcher on older persons and the research. And she will also talk to us a bit about the violence that occurs not only within the family or the community, but also in bigger contexts, right, of conflicts. We had in March also a side event by us on the situation of older persons in Ukraine, and I think you will expand on other situations like that. Thank you, Bridget.
Okay. Thank you very much, Sylvia, and thank you to the independent expert and Your Excellency, the Ambassador, and the other co-sponsors for giving me the opportunity to speak here today. In 2017, a Rohingya woman who had fled Myanmar security force atrocities in Rakhine State told Human Rights Watch that she had seen security forces push older people who couldn't flee back into burning houses. She told us that, she said, "I think they wanted everyone to leave, and those that could not leave, they put into the fire." The impact of war on older people has never been more visible than in the conflict in Ukraine. And the work of our colleagues at Amnesty International have exposed grave violations against older people there. Our own research at Human Rights Watch between 2013 and 2021 across 15 countries around the world found that older people can experience the same abuses during armed conflict and other large-scale violence as younger people, and in some circumstances face heightened risk related to their older age. Civilians fleeing fighting at times leave older people behind, and older people may themselves be more reluctant to leave homes they've lived in for many years, putting them at greater risk. Government armed forces and non-state armed groups have unlawfully attacked and killed older civilians and subjected them to summary executions, arbitrary arrest and detention, torture and other ill treatment, rape, abduction and kidnapping, and the destruction of their homes and other property. Older civilians have been killed and injured by small arms, heavy weapons, explosive weapons with wide area effects, and chemical and other banned weapons. As we've heard, older people who have been displaced by conflict also face abuse while in flight or in displacement camps. A 70-year-old man living in a site for displaced people in Cameroon said he had woken one morning by hearing gunfire in August in 2020. And he said he immediately left the house and saw numerous Boko Haram fighters outside. As he ran for his life, they shot him in the stomach. While older people are protected by international humanitarian law and international human rights law during armed conflict, in practice, their needs and protections are often disregarded by parties to those conflicts. However, despite the heightened risks that older people face, the UN Secretary General's Protection of Civilians reports have paid very little attention to older people. And the Secretary General's 2019 report on older people in emergency crises didn't address abuses during the conflict itself. And by 2021, only one UN Security Council resolution had condemned violent attacks on older civilians. But of course, it's not only in times of war that older people are at risk of violence, abuse, and neglect. Despite promising laws in South Africa that guarantee older people's right to care and support services at home and in the community, current government policies are leaving hundreds and thousands of older people without access to the support that they're entitled to. Some older people who are left without this needed home-based support and services may be at greater risk of violence and abuse. One government-employed social worker that I spoke to told me that older people are exposed to various dangers when they're isolated and not getting the home-based care and support that they're entitled to. They are raped, killed, and there's gender-based violence, she said. Older people themselves told me time and again that they felt unsafe in their homes. They were scared of crime, abuse, or of drug use by family members. There's no national data on the prevalence of violence, abuse, and neglect of older people in South Africa. However, rates were high in one small localized study on elder abuse, and one government survey found that older people are more likely than the general population to be affected by consumer fraud, robbery, and personal theft. Another survey found that homicides of older people mainly occur in a house during the week and daytime, while homicides of younger people tend to happen in public spaces, during the weekend, and at night. And so older people who are isolated in their communities without access to care and support services may be at greater risk of crime. The resolution at this council session on violence, abuse, and neglect is a timely opportunity to lay out states' human rights obligations towards older people. States have human rights obligations to prevent, investigate, prosecute, punish, and provide redress for all forms of violence in both the public and the private spheres, perpetrated not only by states, but also by non-state actors. These obligations, as we've heard from the independent expert, are grounded in a number of different rights across international human rights and international humanitarian law, including protection for older civilians during armed conflicts in the Geneva Conventions and protection from violence in international and regional human rights treaties. But this dispersal of state obligations across a number of treaties and the absence of a dedicated international standard on older people's rights to be free from violence, abuse, and neglect contribute to a protection gap that urgently needs to be filled. And so to that end, the Human Rights Council should heed the independent experts' recommendation on the need for a comprehensive international legally binding instrument on the human rights of older persons that would address the right to life free from violence, abuse, and neglect in older age. And the Council should commit to accelerating progress towards drafting of such a convention as soon as possible. Thank you.
Thank you so much. Thank you so much, Vichy, for bringing information from your report on South Africa, only less than 2 months ago was launched. Also from the report from Amnesty International that was presented here in March, and we have colleagues here as well. And thank you for bringing the resolution that is led by Argentina, Slovenia, Brazil, Gambia, and the Philippines. And so please, if you haven't read the draft, and please, we will call on you to co-sponsor the resolution. Now I will open the floor. I just need to say that we have only 10 minutes because as the interactive dialogue has to continue at 3 o'clock, so at 5 to 3, we will have to run back and breathe. And so please raise your name, please. I see Austria for the moment, so I will give the ambassador of Austria. Thank you.
Thank you very much. And dear delegates, esteemed panelists, and valued participants. I would like to begin by expressing my gratitude for the insightful discussions on such an important topic. We strongly believe that the promotion and protection of human rights should extend to all stages of life, including old age. And Austria is committed to taking concrete action to eliminate gender-based violence faced by older persons. In my country, the rights of older persons are given high political priority. We have laws and institutions that represent the interests of older persons and protect their rights. Gender-based violence and discrimination against older persons often go unnoticed or are not recognized as such, and that's why we take targeted steps to raise awareness among families, elderly care home staff, physicians, caregivers, and the public about all forms of violence against older persons. And we've also taken steps to enable older persons to seek help, including by setting up a hotline. At the international level, we need to step up our efforts and coordinate future joint actions if we are to achieve adequate rights-based solutions for older persons. And to this end, Austria will host the International Conference on the Human Rights of Older Persons in Vienna from November 29 to December 1st, 23. It will serve as an international dialogue platform for member states and civil society stakeholders to discuss and prepare solutions ahead of the conclusion of the thematic issues segment of the next open-ended working group on aging in New York in 24. And for more information, I would invite you to look at the flyers which we are distributing in the room on the conference. And my last point is a question, Madam Independent Expert. So what would you see as steps, what would you suggest one does when one witnesses violence against other persons? Thank you.
Thank you very much. Israel.
Thank you very much, Sylvia, for convening us, and thanks all panelists. It was very interesting, and thank you, Claudia, as well, very much for all the work that you are doing on this very important issue. I don't want to talk about Israel, but I wanted to talk about, I've heard in all the statements, especially with you, Claudia, and of course also with the representative of Human Rights Watch, and on the legal obligation. Of course, you know, we come from countries, we all have legal obligations, we all have rules, we all have, the question is, of course, many times the implementation, as you said. And it's more than that, it's the issue of raising awareness of the public, I have to say. Including in my own country, from time to time I see things and we see reports, but it's more in-depth question of how do we actually create champions among our society for this issue. It should be on parliamentarian, and that's something I'm grappling with myself all the time, because the members of parliament change, and how do you know in the one parliament you have and then you don't have, and you start again. I see it in my own country, and so raising awareness on political level, raising awareness among the general public, of course, education of police forces, of all, I don't know, it's like this major effort. It's much more than just legislating laws that many countries have, but it's still, so I don't know, it's very frustrating, I have to say. But perhaps you have more insight on this, on really raising this awareness, because also with parliamentarians, I feel that you do some work with and then they change. So thank you very much, really, because it's a very, very important topic, and we all have it in all our countries. So thank you.
Thank you very much for sharing your frustration. Welcome to the club. And but I would like to give the floor now to Ambassador of Slovenia. Thank you.
Thank you very much, and thank you to all the panelists. And I just want to continue where our Israeli friend has finished on the need for the, I believe, cultural change that we need. And we saw with the 3 conventions that already are in place, and the one on the rights of women, children, and people with disabilities. Once we had this convention, the cultural change has happened, and one of the ways that we can maybe help this cultural change happen before we finally get to start putting together a legally binding instrument is really engage with more intergenerational dialogue. But if there are other ideas from the panelists how to bring this about, I would very much be interested in hearing that. And let me also just use this opportunity, Ms. Perel, you mentioned the core group and the resolution. Apart from the core group, there is also a group of friends that for some countries could be an easier way into getting to know this topic more and commit on this topic. This group has expanded. We are happy that Ambassador Alcantara has been one of the panelists who from a country that recently joined. So the countries are also invited to join this group of friends of the human rights of older persons. Thank you.
Thank you very much. And I like this already reacting to what somebody else said, and I think it's very good. Before I give the panel, if anybody wants to say something more, if you don't have a nameplate, you can raise your hand. It's now the moment. If not, I will ask yes, you want Alfonsina from the
Yeah, sorry, I know there is not so many time, but thank you, Excellency, for your speech. I would like just to, if you can share, since that you've been busy in Dominican Republic, if you can share one of the good practices in the Dominican Republic against violence. So like that, the panelists have some experience about your visit in the Dominican Republic. And thank you very much.
Thank you. So I will ask, Ambassador, would you like to react to any of the questions? Or?
Just to say that I believe, I'm sorry.
No.
Okay. Just to say that I believe in champion. I believe in looking for a champion. In my country, we had a champion for persons with disability. And that champion created a center for rehabilitation. And we have champion against in the treatment of cancer too. So I believe in looking for a champion in every country for this thing. That's my observation.
Thank you so much. In regard, how should we treat if we see violence? I think what we also see is that many people do have problems where to go if they see violence against older persons. It's different if you see violence against women or violence against a child. You regularly know directly where to go. But in regard of older persons, very often you don't have the focal point, and even police does not always know how to tackle the issue. So thank you for the questions. I think this is something where we can also improve the national legal situation, that we, on the one hand, raise awareness that this is a needed topic to get some specific focal point there, or a specific part in the police force to tackle these kind of issues. I realize that there are some. Thank you also in regard of the implementation, but I still think from my perspective, champions are goodwill ambassadors as well, but I also believe what the ambassador of Slovenia said, that we would get the paradigm shift with a new convention, because this is really a game changer. We saw this with persons with disabilities. Nobody would have believed that persons with disabilities are an active part in society before we got the convention, because they were not included as participants in political decision-making, for example, as it should be. So I think this is really a paradigm shift if we get the convention. I fully agree that there needs to be much more awareness in the countries. And I think one of the things is that the participation of older persons is not as high. And even those who are vocal don't speak on older person human rights. They are the champions for other issues. So I think this is something we need to change. Positive example from Dominican Republic. I think you do have a lot to share, but I will share CONAPE, which is the national agency for older persons in the country, and they facilitate everything as a focal point. And this is already very good structural idea to have a specific actor on the national level, and this can be a good copy for others as well, even though maybe they need some more resources to do everything, and also a kind of upgrade as a ministry would be a very valuable idea. Thank you.
Thank you, Claudia. I will ask first Bridget if you can react, because you asked the question.
I mean, I agree. I think the power of a new convention in bringing about that cultural change is a contribution that it would make. It's not just about being a piece of legislation. It has that symbolic power as well. But I also think it goes beyond raising awareness. And I think that what we're talking about here is challenging a deep-seated social norm. When we're looking at ageism, you know, it's often tolerated, it's invisible, and it can be condoned. And so I think not only do we need to challenge that from the top through a convention, but I think we also have to first look towards ourselves as well. And we need to think about our own internalized ageism and the attitudes that we have to our own older age and getting older. And so I think in order to make that paradigm shift that we're talking about, you know, you need the sort of the international standards, but you also need ways in which to challenge a deep-seated social norm, just as we do when we need to challenge racism or gender-based discrimination as well.
Thank you, Bridget. And I will, Tony, you have a...
That's my last word. Yeah, if you need to change a culture, you need to talk about it as often as you can. And the International Instrument on Protection of Rights of Older Persons is going to be a clincher, but national human rights institutions are there for us in all our countries to do the groundwork, to soften the ground, so that by the time this international instrument comes, it's a smooth sail. Now, the capital should always be in touch with their national human rights institutions at home. This is the kind of work we do. And if there is collaboration between the capital and the national human rights institutions at home, I think this shift in culture and tradition will have a lot of impact. Thank you very much.
Thank you very much, Tony. Thank you so much to the panel. I would like to thank the co-sponsors of the event. I would like to say I managed to not even talk too much myself, which is an effort, especially on this topic. But I really want to take away the message. Of course, the call for the need for a legally binding instrument, the need for champions, and I would like to say that we need for member states champion as well. So So it's through the group of friends, through your own participation in the council and pushing the issue of older persons at all other resolutions, not only on the resolution of older persons, and to raise awareness at the council and to accelerate the work on our rights at the council and elsewhere. And with that, we were going to close. Thank you so much, and we'll see you again in room 20.
Farrell, thank you.
Oh, I made so many mistakes.
No problem at all.
Embajadores,